Hello, and thank you for joining to hear about promising prostate cancer research from the annual conference of the American Society of Clinical Oncology Genitourinary, or ASCO-GU 2023. My name is Dr. Aly-Khan Lalani, and I'm a medical oncologist at the Juravinski Cancer Center and assistant professor at McMaster University in Ontario, Canada. This year's conference took place in February in San Francisco, and nearly 5,800 attendees joined from around the world, either in person or virtually. A diverse range of physicians treating prostate, kidney, and bladder cancer were in attendance. ASCO-GU is an opportunity to bring together researchers focused on improving outcomes for patients with these cancers, and there was a significant Canadian representation at the meeting. A group of 6 Canadian prostate cancer treaters, including both medical oncologists, radiation oncologists, and urologic oncologists, were assembled as ASCO-GU ambassadors. As ambassadors, we attended the conference and summarized key research findings which can influence the care of patients with prostate cancer. We identified promising research that is applicable to the treatment of 3 prostate cancer scenarios. One scenario was localized prostate cancer, that is, cancer that has not spread outside the prostate. Here we saw results from the PACE-A trial, which compared radical surgery to a radiation method known as stereotactic body radiotherapy, or SBRT. This trial was the first to investigate these treatments against one another using a rigorous scientific method. The trial showed patients receiving this type of radiation therapy were able to hold urine better and had less sexual discomfort, but greater bowel issues compared to those who had surgery. The second scenario was newly diagnosed hormone-sensitive advanced or metastatic prostate cancer, that is, new stage 4 prostate cancer. Here, we saw data from the large ARASENS and PEACE-1 trials that tested 2 forms of triple therapy. Now, an established standard is chemotherapy combined with standard hormone therapy injections. This is known as chemo-hormone therapy. These trials showed that adding a next generation hormone therapy in the form of a tablet, either darolutamide or abiraterone with prednisone, in combination with chemo-hormone therapy, was better at prolonging survival and preventing worsening of the cancer than chemo-hormone therapy alone in patients with prostate cancer that had spread significantly throughout the body. Furthermore, this treatment combination was safe for generally healthy patients above or below age 70. Obviously, as with any treatments, side effects should always be discussed between patients and their physician. This means that for patients with newly diagnosed stage 4 prostate cancer who are starting or recently started hormone injections, they may discuss with their physician about stepping up to a 3-drug option with a next generation oral hormone therapy and potentially chemotherapy if they are suitable. The third scenario was advanced hormone-resistant prostate cancer, that is, prostate cancer that is resistant to hormone injections alone. Here, we saw data from the PROPEL study, which had previously showed that adding a pill, which specifically targets the genetics of a cancer cell, a PARP inhibitor called olaparib, to abiraterone was better than abiraterone alone for patients whose cancers are resistant to standard hormone therapy. New research was presented at ASCO-GU, which showed that this drug combination improved the time before worsening of the cancer and a potential improvement in lifespan or overall survival. Also, the TALOPRO-2 study showed that adding a pill that targets the cancer genetics, a PARP inhibitor called talazoparib, to enzalutamide, a next generation hormone therapy, was better than enzalutamide alone for patients whose cancers are resistant to standard hormone therapy. These results showed improved time of being free from cancer progression. However, data for overall survival is not yet ready for analysis. These improvements were most noticeable in a patient population who had specific mutations in the genes of their cancer cells. Therefore, scientists are still trying to figure out which patients are best suited for treatment combinations. It is important for prostate cancer patients around the world to discuss with their oncologist on how to check the genetics of their cancer through blood or tumor sample tests to see if they are eligible for these options. We hope you enjoyed this video. Thank you for your interest in therapeutic innovations in prostate cancer, and thank you for taking the time to listen.